Hi, I'm Dr. John McAllister. I'm going to discuss total knee arthroplasty or knee replacement today. Everything that I go over is also available on St. Peter's Bone and Joint website. Well, total knee replacement, if you're watching this talk, you obviously have knee pain and hopefully you've had it for quite some time and you've failed conservative care, because we certainly try many things besides operations such as a knee replacement. Joint replacement has been in place for certainly well over 50 years. It's not a new idea. Some of the newer concepts involve a little less invasive surgery. I do that less invasive surgery. I don't market it as such. I don't believe that a knee replacement should ever be considered minimally invasive. It's very invasive. We have changed things so that the surgery is now done within, an hour and 15 minutes, maybe an hour and a half on average. The people are typically in the hospital 2 or 3 nights after surgery, and they can go home. You're able to bear weight immediately. When I started doing joint replacements back in the 80s, we were often keeping people in the hospital for 2 weeks, so we've certainly come a long ways, made the operations less risky. But a knee replacement, it basically involves resurfacing the joint. And there's sort of an idea that we take the whole knee out and put in a new knee, and that's not at all what we do. We're really removing about 1 centimeter of bone from either side of the joint. There's this model here shows the femur that's been replaced or covered on the end with this metal, and I'll show you the parts in a second. And then the tibia here. And we've removed, again, about 1 centimeter of thickness of the bone. We try to line that up so it restores, makes the joint straight once again, or properly aligned by how we make the cuts. These are the actual parts that I use. This is a 3D knee, but this is a femoral component. It's made of cobalt chrome. Pretty much all the joints are made out of cobalt chrome and high molecular weight polyethylene or plastic. Recently, the company I've used has been adding vitamin E to this to try to increase the longevity of this plastic. This is the part that wears. This is why a joint replacement can wear out. This plastic, we hope, will last 20 years. Most of the knees we did 15 years ago are still working. About 90% of those are still working. And we've changed the plastic a little bit now. I guess we'll wait another 20 years to see if it was really better than what we were doing. But the knees allow for a nice range of motion, and this one in particular is designed to allow for a fair amount of pivoting. So it's nice for golf and certain activities of being able to twist the leg a little bit. I don't know if that shows, but it can rotate and pivot. So the joint replacement is done in the hospital. Again, you're in the hospital typically 2 or 3 nights afterwards. There's a course or class that you can take to help you understand what's going to happen in the hospital. We do a good job of getting pain relief for most patients. Many of my patients never take any kind of injections for pain. They just take pills and do fine with that. So I think we've made some big progress with making it not such a bad experience. And I have many, many patients that come back for the second knee and are not concerned about it at all. Once the joint is in, again, you can bear weight on it. We use a CPM machine to help move the knee early. I like to get the knee bending over 110 degrees the day of surgery and straightening it all the way out. So we start that right away, and then you'll use the CPM machine for about 3 to 4 weeks, usually for 4 to 6 hours daily. We have physical therapy, and people use a walker or crutches. Most people use a walker. It's a little easier to manage to get around. You can put all your weight on it, but it helps protect the joint. It helps as the strength comes back. It's safer, decreases the risk of falls or damage to the total joint while it's healing. There's physical therapy that will typically come to your home for the first about 3 or 4 weeks. They'll come to your house, and a nurse will come out and check on you. We typically don't have any staples or anything to remove, but the nurse will check the wound, and the physical therapist will come and help you with your exercises. And I usually see people back at about 4 weeks after surgery. And at that point, we can go over do's and don'ts and increase activity. Probably start some outpatient physical therapy at that time as well, because home therapy will be done by about 4 weeks. For most people, it takes about 3 months to really get happy that you had a knee replacement. The first month, it's sore. The second month, you're tired of the exercises. And by the third month, you start thinking, okay, this was a pretty good idea. But it really does take about that long. Some people feel really good sooner, but I think on average it's about 3 months. And it probably takes a year to get to 100% after a total joint. There's a few things that you should know. You will set off metal detectors when you go through the airport. There's not a magic card I can give you that'll help with that. You'll just have to tell them you have a knee replacement, and they'll pat you down to make sure you don't also have a pistol or a gun of some sort. And you'll need to take antibiotics for any dental work. I'd prefer you wait 3 months after surgery to have any dental work, even teeth cleaning, because a lot of bacteria get in your blood, and it may go to the joint replacement and cause infection. And while we're talking about the risks of surgery, infection is certainly our biggest concern. The infection rate is probably about 1 in 150 cases, so most people don't have to deal with that. We do our very, very best to prevent infections. We use antibiotics, we use special scrubs and showers that you do before surgery. We do some things in the holding area before you go into the operating room, and then we prep again in the operating room. We wear these spacesuit-like things when we operate, so we're not just using a mask, we've got another shield over that vents out the back, so we're not breathing over the wound. And despite all of that, sometimes people get an infection. There's bacteria on our skin that we can't completely remove. It gets there somehow. If you get one, I'll help you with it. Neither of us will be happy about it. Sometimes the joint has to be removed, so it's a big deal if you get one. I'll do my best to prevent it. The other risks, I suppose, bleeding. I think less than 10% of my patients get a transfusion. It may be less than 1 in 20 now. And most of the people that get a transfusion after a joint replacement have anemia to begin with, or usually older people that are smaller and just don't have a lot of extra blood. They can't afford to lose much, I suppose. But most people don't get a blood transfusion. We use a cautery device that helps seal the tissue, and that decreases the risk of transfusion as well. There's blood clots that can occur after joint replacement, and we use a blood thinner for typically a couple of weeks after total knee replacement to prevent blood clots. The other risk would be stiffness, so we do all this therapy and do these machines, and sometimes people still get stiff, and occasionally I have to take people back to the operating room 4 to 6 weeks after surgery, give them a short anesthetic and bend the joint, try to kind of free it up and get it to move better. Again, that's not common, but maybe 1 in 100. And then there's less common side effects or risks. Heart problems, anesthesia-related strange things that can happen, kidney problems. I mean, you could probably think of anything and it could happen. Nowadays, it's anesthesia. I think it's a lot like riding in a car. Something bad could happen, but if we have to go places, we just get in and drive. So I think it's reasonably safe. And for most people with any medical problems such as diabetes or high blood pressure or heart disease, we'll ask you to see your primary doctor prior to surgery to be evaluated, make sure that you're a good candidate for an anesthetic and a joint replacement. So we hope that these knee replacements will last you 15 or 20 years. It's possible to change just the plastic if you actually just start to wear through that and we catch it in time, so we can actually snap this out and put in a new one and keep the joint attached to the bone. I have done revisions like that. But if you're young and you're hoping to last for 30 or 40 years, we really haven't proven that that can occur with knee replacements at this time. So I hope that answers your questions, and I'll be happy to discuss joint replacement more with you.